Hello friends, it's Dr. Furley here. Today we're going to talk about hair loss. As always, if you enjoy these videos and would like to see more of these videos, don't forget to follow us on Instagram and subscribe to our YouTube channel at Carmel Medical. Hair loss is a very popular thing, and unfortunately these days it's very common among both male and female. Hair loss can have a cause, but unfortunately most of hair loss around the world is unknown and people just lose hair as they age. But let's start with the beginning on what should we do when we start seeing thinning of our hair, or where you see excessive amounts of hair after you wash your hair or after you comb your hair or brush your hair. It is, of course, and let me tell you 100%, it is normal to lose some hair. Maximum of 100 strands. Not saying that you should go count each and every single strand that you lose daily, but it is okay to lose some hair every day because our hair goes through phases. There is a phase of 3 months that the hair goes through growth and you feel like no hair loss during those 3 months, and I'm sure everybody has experienced that. But then after that 3 months, you got to give your hair a chance of a 3 months of shedding. So the old hair comes out of our scalp, so the new hair has its place. This is a normal process. And if you only go through phases of hair loss, like say 2 months of the year you lose hair, but the other 10 months of the year you're okay, that's normal. Relax and enjoy life. However, if you feel like your hair is thinning more than normal and you're losing way more than before, then you can make an appointment with your doctor and do certain things. The first step that I would recommend people to do is to ask to their doctor to do a complete blood test. Things that can commonly cause hair loss are imbalance in our thyroid hormone, commonly hypothyroidism. Low thyroid can cause hair loss. Obviously, those group of people are going to have other signs and symptoms, but they can also have hair loss. And if you would like us to talk about hypothyroidism in more detail, I would love to do that, and just let me know. Another disorder that can commonly cause hair loss is low iron. Low iron can be a very common thing, especially in female that go through menstruation monthly and they have heavily bleeding every month. But male can have iron deficiency as well, so it's another factor that you should get tested on your blood. Vitamins that their deficiency causes hair loss is vitamin B12 and vitamin D. Most of the people in North America, they do not have vitamin B12 deficiency unless you're a heavily drinker and you drink a lot of alcohol. Otherwise, most people don't have, because we have a good nutrition values. Or vegans, people that they do not eat a lot of groups of foods, they can have B12 deficiency and iron deficiency as well. But majority of people in North America are okay with B12. Vitamin D. Unlike B12, most people are deficient in vitamin D. And vitamin D is not just important for our hair, but science has shown that low vitamin D is a link to a lot of diseases. So it's normal to check your vitamin D to see what level it is, because depending on what level the vitamin D is, the doctor is going to define of what dosage of vitamin D supplement you should take. Obviously, there are other hormones that are important in our hair growth. In males, testosterone. So you can always, all those gentlemen out there, they can ask their doctor, can you please check my testosterone level, the free testosterone level, and the bound testosterone level? I want to know my level. And usually, if your hair loss is because of testosterone level, you're going to have low energy and fatigue as well. So it's a good hormone to check. In females, they can check their estrogen, progesterone, LH, FSH, and testosterone as well, because imbalance in all these hormones can cause hair loss. And usually if they have imbalance in these hormones, females are going to have hair loss on their scalp, but excessive amounts of hair in unnecessary areas like their chin or the mustache area, which we do not like it at all. But if the hair loss is because of some sort of hormone imbalance or vitamin deficiency, then fixing these problems is definitely going to grow your hair back and your hair loss is going to be solved. However, this is not the only cause. Second cause of it can be various group of autoimmune diseases. A common disorder that commonly presents in people with just hair loss is lupus. So your doctors can check you for antibodies for those diseases to make sure that you're not being affected by those factors either. But let me tell you that majority of people are going to have these blood tests and antibody tests, and all their physical examinations are going to be normal. So then what do we need to do in this case? Nutrition is a very important thing for our hair, and it's very important for us to have a very high protein diet if we want to have a healthy hair and obviously skin. Our body does not look at a hair as an essential or an important organ, but for us, hair is an organ and it helps in our look and give us confidence. So for us, it is important. So let's say you do have B12 in your blood. Your blood test shows that your B12 is normal, or your vitamin D level, it's almost normal. In those cases, what the body does is that it saves those vitamins and nutrients for more important organs in our body, like our heart, our lung, or our brain. And it says to itself, I'm not going to give it to the hair. Hair is not important. That individual can live without their hair. But if you have excess amount of those nutrients and vitamins in your body, then the body can share it with the non-essential organs like hair. So it's very important to take those things seriously. My recommendation for you is that groups of vitamins that you can take. One supplement that I recommend all of you to put in your daily routine and take it every day is vitamin D. Vitamin D is a very important vitamin, and it can do magical things in your life. It can bring up your energy. It can prevent breast cancer, colon cancer. Recently, research has shown that it has even prevent MS, which these diseases are unfortunately in our population is very, very common. So take your vitamin D every day and take it after your breakfast, because vitamin D is a fat soluble vitamin and you need food in your stomach for vitamin D to get absorbed in your blood. And you can get vitamin D in any pharmacy. I get mine in Costco and I'm really happy with it and it's really good. Another vitamin that is really good for hair is biotin. Biotin can do miracles for our hair. But let me tell you something. None of these vitamins are going to work overnight. And you need to take these vitamins persistently for a long period of time in order to show effect and positive factor from them. So make sure to add this into your diet if you have problem with hair or skin or nail, because it will help you a lot. Now, if you want to be more of an extra step healthier and extra step fancier and take care of yourself a lot, monthly you can go to your doctor and get vitamin B12 injection. Vitamin B12 injection can help with your energy, can help with your hair, your skin, your nail, and overall it's a great vitamin to add to your daily and routine lifestyle. It's not necessary, it's not essential. You can also get it from food, but if you feel like you have done everything and you need a little kick, just add this to your doctor and ask your doctor, doctor, can I have an injection of vitamin B12? And I'm sure they will happily help you. Another factor that you can pay attention to it is make sure to use good shampoos. Shampoos that are sulfate free, shampoos that are alcohol free, because sulfate and alcohol tends to make our scalp really dry, and eventually if the scalp gets really, really dry, the hair will fall off. There are certain moments in life it is normal to lose hair. If you go through a severe stress in your life, if your weight drops 10 pounds severely all of a sudden, you will lose hair. That's okay. Eventually, when your hair goes back and your weight goes back to normal and your stress situation becomes back to normal levels, the hair will grow back. If you lose a loved one and you get severely stressed, that can make you to lose weight as well. Those are okay because as soon as the stress goes away, the hair comes back. Pregnant ladies, they gain a lot of hair while they're pregnant because the hormones are juicy and high in our body. But as soon as the baby comes out, they all that extra amount of hair. That is normal. Your head is going to go back to the normal it was before you got pregnant. There are a group of people that they can have patchy hair loss on their hair. This is a patchy alopecia. Alopecia is a medical term used for losing hair, becoming bald. Those people, other things that they can do, they can go to their doctor and they can inject steroids directly into the scalp. Steroids act against autoimmune, and they think that alopecia is the fact that our immune system is affecting the hair to kill it. So we can give the steroid, which is counteractive to the immune system, so it can help a certain group of people. There's another way that is actually really good. I have actually used it myself and I loved it and it worked for me, is vampire infusion. Where what they do, let me explain it to you, is that they get blood from your own, they put it on a centrifugation machine and they get the plasma out of it, which is the protein portion of our blood. And they inject that plasma back to your scalp. This is like direct stimulation to the hair follicles that come on, get up and start working and give me some thick and nice and shiny hair. But unfortunately, all these procedure and stuff can become a little bit expensive and can be cosmetic. But if you really want to have a good looking hair, it's okay to lose these things and it definitely works. As always, if you have any question, like literally any question, feel free to ask me either by direct message if you feel more comfortable, or leave it down there. And if there's any topic that you would like me to talk about it, let me know. Have a wonderful day and stay healthy.